Hi everyone, I am Asha Nayak. I'm a lactation consultant. I'm a IBCLC, that's an International Board Certified Lactation Consultant, and an IYCF from BPNI, that is Infant and Young Child Feeding. I'm here to basically help promote the awareness about breastfeeding. So as you all know, August 1st is the International Breastfeeding Week. So happy International Breastfeeding Week to all of you. And the theme this year is to educate and support the mothers and the family who's going to embark on this process of breastfeeding. So WHO has given us an official guideline to start early initiation of breastfeeding within 1 hour of delivery, and also to continue breastfeeding exclusively for 6 months. And also the third thing is complementary foods, which is nutritionally adequate solid foods, mashed, which can be started after 6 months of breastfeeding, and it should be continued along with the breastfeeding, but breastfeeding should continue for 2 years and beyond. Globally, the breastfeeding rates are around 40%. Even in India, it's around 39 to 38% of exclusive breastfeeding that is occurring. So what is happening to the other 60%? What is happening is they are dropping out. They are not doing exclusive breastfeeding. They are mixing formula and then giving the baby. And why is that happening? Because there's no help for them. There's no support personnel who can help them. The importance of breastfeeding is well known to all. We all know that breastfeeding improves our immune system, the baby's immune system, which is so important in this global pandemic. Also, it helps to reduce the chances of gastrointestinal diseases and infections and the lower respiratory infections and the dental malocclusions. So all these problems can be combated if you're doing breastfeeding. Also for the mother, the ovarian chances of ovarian cancer and breast cancer can be reduced if the mother does breastfeeding. Also chances of diabetes, cardiovascular disease can be also reduced. The first thing you have to remember, there are two hormones that is going to help you in your breastfeeding journey. One is the prolactin hormone, which produces the breast milk. That is very active in the first 2-3 days. So the production of breast milk is important. So this is where your shatavari, your methi seeds are all going to help you. After that is the oxytocin hormone. The oxytocin hormone brings the milk to the breast. When the mother is stressed out, or when she is sleep deprived, or the people around the house keep telling her she does not have milk, the oxytocin hormone reduces. And when this reduces, mother's breast milk supply comes down. So what should we all do? We should support that mother and make sure we do not tell any negative feedback to her. So oxytocin is the hormone of emotions. The first milk that comes in is called the colostrum, which is a very sticky milk. This milk, if it is made available to the baby, it seals the baby's gut and prepares the baby's autoimmune system for a lifelong immunity. The initial milk that comes in from the breast is called the foremilk. The milk that comes at the end of the feed is called the hind milk. The hind milk is full of fat, and if this baby gets the hind milk, then this baby is going to sleep for at least 2 hours. Baby is going to put on weight sufficiently. Around 750 to 1.2 kgs a month is what we are looking at, the weight gain. Third is baby should pass urine at least 6 times in a 24-hour period. So if these 3 things are achieved, then you can be rest assured that your baby is receiving enough milk. 2 things I would encourage all women to learn, or all antenatally when they are pregnant they should learn, is how to manually express the milk from the breast, and also how to shape the breast when offering it to the baby. So for manual expression, I'm just going to show you on this breast model to keep the fingers at the edge of the areola and to push it towards the chest wall, press it, and then come rolling forward. When you come rolling forward, that's when the milk gets expressed. One thing I want everyone to learn is about the latch. A deep latch is what helps with appropriate milk transfer. So imagine this to be the baby's mouth. This is the tongue, and this is the the breast that we are going to help the baby latch on. To make good milk transfer, the baby should have a deep latch. And to get a deep latch, baby's chin should touch the mother's lower breast. So like that. And once it touches the lower breast, the nipple should go in along with the areola, and there should be an opening of around 140 degrees of the mouth of the baby. Only then the nipple and the areola will be inside baby's mouth. And the nipple should go and sit back in the soft palate. First is the hard palate, the nipple should go and sit in the soft palate. Only then the sucking is stimulated. So even if you have a flat nipple, because it is breastfeeding, not nipple feeding, so even if there's a flat nipple, as long as the areolas inside the baby's mouth, there'll be good milk transfer. So you can approach your lactation consultant to help you with that. To tackle your common breastfeeding struggles like low milk supply, mastitis, engorgement, flat nipples, you can consult a lactation consultant, and we are available in Sagar Hospitals every day for online or offline consultations. So please feel free to approach us. Thank you.